The oral cavity. The upper GI tract is where initial processing by both mechanical and chemical means takes place. The oral cavity is the entrance to the GI tract. Food undergoes both mechanical and chemical breakdown inside the oral cavity. Gross anatomy that includes the vestibule or the buccal cavity, which is the space between our gums, lips, and our cheeks. The oral cavity proper is bounded laterally by our cheeks, anteriorly by our teeth and lips, and posteriorly by the oral pharynx. The cheeks are covered externally by layers of muscle and compress the cheeks down to help break down and enable mastication or chewing. The functions of the oral cavity are protection against physical and chemical abrasions and pathogens, increasing surface area of food, coating food with saliva, and also initiation of swallowing to deliver food to the stomach. You can see over here we have the hard palate and the soft palate, the uvula, tonsils on the left and right sides, your tongue, the gums, and the lower lip and upper lip. The teeth are collectively known as dentition. A tooth has an exposed crown, it has a constricted neck, it has roots that anchor it to the jaw. The roots of the teeth fit tightly into the structure called the dental alveoli, which are sockets within the alveolar process located inside the maxilla and the mandible. These regions form what we call the gomphosis joint, a non-movable joint. The outer component of the teeth is called the dentin, and then we also have the enamel that protects the outer crown of the tooth. And within it, we also have the pulp. Some key features of mastication include mechanical digestion, increasing the surface area, mixes the food with the saliva, and is under control of the medulla oblongata. Deciduous teeth are about 20 teeth that erupt between the ages of 6 and 30 months after birth. Permanent teeth are the 32 that replace those deciduous teeth. So you can see on the right side we have different kinds, like the incisors. These are the ones that are positioned most anteriorly for slicing and cutting. The canines, these are located posterior laterally and are designed for puncturing and tearing. And then we also have the premolars, which are primarily used for grinding and crushing. And then, of course, we have the molars, which are the thickest and most posteriorly placed, which are designed for also crushing and grinding. The saliva is a major secretion inside the oral cavity. Salivary glands which produce saliva are located both within the oral cavity, intrinsic salivary glands, and outside the oral cavity, also known as extrinsic salivary glands. The intrinsic salivary glands are the unicellular exocrine glands that continuously produce small amounts of secretion independent of food. They produce an enzyme called lingual lipase. This helps break down a little bit of the fat in your mouth. Most saliva is then produced by the 3 extrinsic salivary glands. We're going to have the parotid, submandibular, and sublingual. The parotid gland is the largest gland of them all and secretes about 30% of the saliva through the parotid ducts. The submandibular produces about 60%. And then the sublingual produces the remainder 10%. The primary secretions inside these acini include mucus, thialin, extracellular fluid, and also electrolytes. You can see right here that the sodium gets reabsorbed back into the epithelium, and as well as chloride, whereas bicarbonate and potassium get secreted in. So the key components of saliva are water, electrolytes, mucus, little bits of trace of white blood cells, epithelial cells, glycoproteins, enzymes, lysozyme for breaking down bacteria, and IgAs and antibodies. The main features and functions of saliva. The body produces about 1 to 1.5 liters of saliva daily. Saliva consists of mostly 99% of water, and the remainder are these solids like the salivary amylase. The pH ranges from about 6.5 to 7.5. It helps moisten the epithelia, liquefies the food. 5% of our polysaccharide begins breakdown with the first enzyme called salivary amylase. There's also some immune responses with the help of the lysozyme and also the immunoglobulin A, antibody A. And these secretions are controlled by the 2 cranial nerves, the facial nerve and glossopharyngeal nerves. Swallowing, also known as deglutition, is a process of moving the ingested materials from the oral cavity towards the stomach. There are 3 main phases here. The voluntary phase is controlled by the cerebral cortex and begins when you initially swallow the food by chewing and then pushing the food back with the tongue superiorly against the hard palate, and this then directs the food products down towards the oral pharynx. So the pharyngeal phase consists of the swallowing reflex as initiated by the arrival of that food product down towards the oral pharynx. The swallowing center that controls this reflex is inside the medulla oblongata. It receives input from these tactile receptors in the oropharynx, which affects involuntary transport of the bolus from the upper pharynx down toward the esophagus. There's going to be a slight change of the larynx by elevating it via some of the extrinsic muscles. The larynx moves a little bit more anteriorly and superiorly, resulting in the epiglottis covering over the inlet. And now the food gets pushed down towards the esophagus. You can see right here the picture showing you the food bolus being squeezed down after that first voluntary phase into the pharyngeal phase. Then the esophageal phase is the involuntary aspect and involves a passage of the food product through the esophagus and down towards into the stomach. It should be noted that the upper esophagus is voluntarily controlled. However, the lower esophagus is involuntarily controlled. So once it gets past this region, it is a point of no return. The food travels through the esophagus to reach the stomach. There are several nerve controls of the esophagus. There are stretch receptors, a signal through the enteric nervous plexus to the smooth muscle to begin contraction. The efferent neurons further stimulate contraction. And with the help of gravity and that wave-like motion of peristalsis, it begins pushing the food downwards. This is the connection to the stomach. The esophagus is normally collapsed as tubular passageway between the pharynx and your stomach, and it's about 10 inches in an adult. It begins at the level of the cricoid cartilage, which is your Adam's apple region, to the vertebral bodies and posterior to the trachea. It passes through that small little hiatus in the diaphragm and connects directly to the stomach. The upper portion of the esophagus contains a superior esophageal sphincter that contracts via the circular skeletal muscle and is closed during inhalation. And then the inferior esophageal sphincter is contracted with a ring of circular muscles that helps prevent any kind of reflux of the materials from the stomach back up. So these two sphincters are very important to control the food products moving in one way and not going back up. Focus on a disease. Gastroesophageal reflux disease, also known as GERD. Reflux esophagitis occurs when acidic chyme, or the food products from the stomach, refluxes back into the esophagus, causing a lot of burn, pain, irritation. The esophageal epithelium is poorly protected against any kind of acidic content and therefore gets easily damaged and inflamed. This kind of reflux disease is most common in folks that are overweight, smokers, and people that have hiatal hernias. Eating a large amount of spicy foods or large meals or ingesting too much caffeine may worsen this GERD. As a result of GERD, there could be a buildup of scar tissue in the esophageal tissue, which can lead to esophagitis. And in some cases, that can even cause higher risk of cancer. So this image shows you the chyme and the stomach contents backflowing up into the esophagus.